Good afternoon. Welcome. This is Faisal Hassan, your Member Provincial Parliament for York South Western, joining you again another Saturday from 3 to 4 to hear your concerns and answer some of your questions and to talk about this week's issues. Before I begin, I would like to acknowledge at this time the land that we now know as York South Western is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations Inuits and Métis. Those who are just joined, you're joining Faisal Hassan, NDP, and you're joining Instagram Live and my YouTube. If you have not subscribed my YouTube, you can subscribe it. So you get instant updates as well. You can do that. Also, you're joining Instagram Live as well as also my page and also Instagram as well. Yes, YouTube and Twitter as well. So welcome and thank you for joining this afternoon. There's a lot of things to talk about this afternoon, folks. First, happy Ramadan Mubarak, and celebrations begin. Today is the 5th day, so I hope it's going easy for you. And thank you for joining me as well. Welcome, Mohammed, and welcome, Amanda. Welcome, Frank, and Ramadan Mubarak to you all. I just want to quickly share with you just a statement, press release that my leader just a few hours ago shared with you. I just want to read quickly. Andrea Horvath says, it is time to fight to save Ontario from COVID-19 by stopping Darkfort's plan for a police estate instead of a public health action. Our hospitals and intensive care units are overrun. People are dying, and Darkfort chose cutting, not paid sick days. He chose a police estate instead of vaccines for essential workers. He is shutting down playgrounds instead of shutting down non-essential warehouses and factories. My leader, Andrea Horvath, continued with this statement. We need public health action, not a police state, and I agree. Andreas and the official opposition member of our caucus will meet this weekend also to lay out legislative plans to stop the carding and check stops Darkfort has planned, and instead get basic days, a shutdown of non-essential businesses, vaccines sent to hotspots, communities like ours in York South Western, and financial help for workers and businesses in place urgently. I hope Andrea Horvath, my leader, will call on all MPPs of all party stripes to join us, the official opposition. And Andrea says and continues, and I'm going to just read for you. Andrea is thinking of you. I'm thinking of the people laying in crowded hospital hallways, struggling to breathe. I'm listening to Black, Indigenous, and racialized people who know cutting will target them because it is always has, and I'm listening, my leader says, to businesses that will be destroyed while Ford allows the virus to rage on. She says, I hear you, I see you, and together we'll fight for you. And that's just a statement a couple of hours ago that my leader, Andrea Horvath, has shared with you, the people of Ontario. And I was happy to share with you. And folks, this is exactly what we need now, a leadership. And my leader and the entire official opposition is offering that. And we need to put public health front and center, not a police state. Well, those who are joining, you are joining Faisal Hassan, NDP, through my Instagram. If you haven't subscribed, my YouTube, you can subscribe, and also my page, and also Twitter. Welcome, everyone. Welcome Heather, welcome Adam, Anab, welcome Ivan, welcome Mansoor, welcome Jarati says, Faisal, good to see you again. Good to see you again too. Anab says, Ramadan Mubarak to you as well. Frank says here, I'm glad the Toronto Police Service publicly stated that they will not be enforcing random COVID checks on members of the public. It might just be an effort to save face. Well, I think what we want is Dartford to focus on public health, Frank, not police state. It's not about whether they advocate or enforce about the law. This is not right. We don't want a police state, and we know that my leader talked about carding. I have also talked about myself. I have been carded 6 times. I have been carded in the past. So this will lead more carding, and this is not the job of the police. And we don't want a police state. We want to support and listen to public health experts and focus public health. We need public health actions. We need to bring more vaccines, areas where are termed hotspots and high-risk areas, like our community of York South Western and other areas across the province. We need to pay workers paid sick days so that they don't have to be worried when they're ill. They should stay home and be paid. They should be also, workers get paid while they are going to get their shots, their vaccine. And Amanda, welcome. Charity says, I think it is to save face right now as they have enough issues with the public. Charity says, I'm grateful that it was able to get my first shot, but now I have to make sure my boys who are 27, 26, and 31 get theirs. And Charity, you can check West Park Health Care Center. They are taking appointments, folks above 18. I know there isn't being any appointments available, but keep calling, keep checking, keep making sure you get through. That way they'll be able to get their shots as well. Joel Starling, welcome Joel. How are you doing? Hope you're doing well. He says quickly, Doug Ford, the cops, even through my frustration, is with Ford himself. This is the last time you will see me at the weekly meetings on Saturdays. Heather Leach says, welcome Heather. We are taking a major step backwards with reinstating carding. Exactly. We don't need Heather carding. We need a public health action. We don't want a police state. And this tells you the priority of this government. I've just shared with you the statement. My leader have shared the folks, everyone in Ontario. And we should be putting people first and putting public health and priorities of public health first, not just implementing a police state here. We don't want that. Francis, welcome. Heather says, I've been carded many times in the past downtown. It was humiliating as I was simply going to work. Look at that. I can also relate to you, Heather. I have been carded too. Not only once, not second, not third, not fourth, not fifth, 6 times. 3 times with the same officer, part of the 12th division. I'm not sure if it's still there, but this is when you give the police to stop people, this is what will happen. They will simply continue to simply give apprehensions and try to give people carding and discriminate, and this is unacceptable. This solution is not about a police state, is what the people of Ontario want. We want our elected officials to focus on public health now, not bringing a police state. We don't want that. Thank you. Frank says, Faisal fights for us every day, both in the legislature and on the streets. As you know, there is a provincial election next year in 2022 to continue the work of the York South Western Ontario NDP. We need your financial support. Well, folks, if you can, that would be helpful too, to make sure we have a strong a strong fight here in New York Southwestern to hold this government accountable and to have next June 2nd an NDP government. Well, thank you. Those who are joining us, you're joining Faisal Hassan, NDP, Instagram, and my Facebook page, and also Twitter, and also my YouTube. And if you haven't subscribed to my YouTube, please subscribe. Thank you. And also, I was honored to be joined this week, my colleague, Member Provincial Parliament, Teresa Armstrong from the riding of London Fanshawe, for a virtual town hall on Portuguese language, mental health, and addiction services. This clinic closed its doors and recently is stripping the community of vital supports available in Portuguese language and Portuguese community across the province. It have annually they had 1,000 patients. It was also supervised by a psychiatrist, and this is vitally needed to continue the services that it has begun. And I was happy to join also Cidelia Pereira of the Abrigo Center and Dr. Jose Silveira, an associate professor of psychiatry at the University of Toronto, who was instrumental in developing the clinic. And if you haven't seen it, if you haven't watched it, you can watch my YouTube, and also you can watch also my Facebook page. Please do so. And it's also important that we support it. Programs and services like that are vital, important in the middle of the pandemic, because a lot of folks are having mental issues, and program like this has been very successful. It has supported the community, and it is a really very important program, and we need to make sure this program continues. If the Toronto Western Hospital doesn't want the money that the ministry contributes it, then we should be supporting to take that into another home that continues these vital services that really helps them, folks who are Portuguese speakers who are also struggling in mental health. The answer is not to eliminate or cut services that is successful, that has a solid, useful data. The solution would be to learn from that and to actually expand into other programs or services to other communities who might have challenges of expressing their issues in their own language. Folks, welcome those who are joining. And Heather says tenants have already been harassed by the building, by management, about enforcing fines if they don't comply with the mask bylaw, even though these tenants have medical exemptions. Well, thank you. That's also another example. We see that a lot of folks are struggling. Now, when this premier legislates it, it's not right. And this is not right, because we don't want state police or police state. We want public health being supported and provide more vaccines to areas like our community. Get us more vaccines to hotspots and high-risk areas like our community in New York Southwestern. Give all workers a paid sick days. That's what's needed. 60% of workers don't have it. And when they get sick, they should be staying home. That's what's needed right now. Get workers paid time off to get their shots, to get their vaccines. That's what's needed now. And Amanda, welcome. Charity says we have tenants. We have tenants here who do not have medical reason not to wear a mask. They just refuse to wear it. I understand if they have medical reasons, but the ones that don't need to wear one, I understand there are folks who are not considering their neighbors, but I think it's important that they be self-policing, concerned, making sure that they also respect their neighbors and their community. The solution is not a police state, which also we need also the support this government should accept the federal government's offer to help. We need the Red Cross to come in. We need the military, and we need a healthcare staff from any other province that wants to help us. That is something we want because we are in crisis. We don't have to reject that. We need help. Let's take it. But the solution is not a police state. It should be a public health action that's needed urgently. Tanya, welcome. Amanda says, do you know if there will be any pop-up vaccine clinics for ages 18 plus in York Southwestern, in addition to the 2 current locations at West Park and the Community Place Hub? I don't live north of Eglinton, so my husband and I don't meet the criteria for a Humber River Hospital location. Well, thank you, Amanda. That's a very good question. So far, we have West Park Health Care Center and the Western Community Place Hub that is going to start this week. They have begun accepting appointments, and but I heard that the appointments is a challenge, and we need more open spaces so people could have appointments. And I think what I have been focusing has been to have also extra a permanent vaccine facility in our community. I have suggested many locations such as York Recreational Center in the southern part of Eglinton and Black Creek, also the old hospital of Humber River Hospital, 200 Church Street, and also Jane Hub Center. Also, I have suggested a Western Lions Arena, even though there are some issues there because it's not a concrete, it has sand there, and it has been raised that concern with me. But any other places will be welcome to give us more permanent, and we need to pressure Toronto Public Health to provide us more pop-ups, more permanent vaccine facility, and also the ministry. And this is also something I've been raising and will continue to advocate on behalf of our community. So far, we only have that location, those 2 locations right now, from Buttonwood and from Western Road, south of Lawrence. And those who are joining, you're joining Faisal Hassan, NDP, Facebook, and also Instagram, and my Twitter, Faisal Hassan, NDP, and also my YouTube. And if you haven't subscribed to my YouTube, please do so. Thank you. Michael Anthony says, welcome, Michael. Says, hello, MVP Hassan. Hello, Michael. Are you in touch with any BC MPPs who are not in cabinet? If so, what are they thinking? What is their feelings? Well, Michael, I mean, I do believe that a majority of them, I think they have a parliamentary positions. I think there was only one guy who was a backbencher, if I'm not, I think I'm correct, and that was Roman Barber, and he's no longer a member of their caucus. So I don't know what's going on with the BC MPP's caucus because I have no direct communications with them. But I think what they are trying here is to institute a police state, Michael, and that's not what we want. And I think I have read the statement of my leader. If you have missed it, let me just read one more time quickly so that folks that they hear clearly what my leader just said, released this morning. Just give me a minute. Let me just get that to you quickly. I will read it for you folks quickly. And that is just, I don't want to miss it. Yes. And this is it here. Yes. This is what my Andrea just released. If you haven't heard from it early on, and the NDP leader, Andrea Horvath, says it's time to fight to save Ontario from COVID-19 by stopping Doug Ford's plan for police state instead of public health action. Our hospitals and intensive care units are overrun. People are dying, and Doug Ford chose cutting, not paid sick days. He chose a police state instead of vaccines for essential workers. He's shutting down playgrounds instead of shutting down non-essential warehouses and factories. We need a public health action, not a police state. Andrea Horvath, my leader, official opposition leader, also continued with the statement. We'll meet this week and have requested an emergency meeting with all the members of our caucus, and we'll be meeting this weekend to lay out legislative plans to stop the carding and check stops Dark Forward has planned it, and instead get paid sick days, a shutdown of non-essential businesses, vaccines sent to hotspots like our community that has been termed as hotspots, and provide financial help for workers and businesses in place urgently needed. Andrea Horvath, my leader, will call on all MPPs of all parties, tribes to join us, the official opposition. Andrea also says that I'm thinking of the people laying in crowded hospital hallways, struggling to breathe. And she says, I'm listening to Black, Indigenous, and racialized people who know carding will target them because it always has. I'm listening to businesses that will be destroyed while Ford allows the virus to rage on. I hear you, I see you, and together we will fight for you. And that's, folks, the statement just a couple of hours ago, my leader, Andrea Horvath, released, Michael. So that's also, if you have missed it, there you have it. And the solution is not a police state. We need a public health action. Nasra, welcome. Charity says, I have severe asthma and I wear my mask when I go into stools and in common area of my building. I hear you, and I think you're right. Your neighbors should respect and wear their mask whenever they are, and they should also practice social distancing, washing their hands. That's very important because we have to work together. It's very important, but the solution is not a police state. We need to listen medical and the health experts, not the police. Police has nothing to do with the public health. We don't want a police state in Ontario. We want public health provided, more vaccines, more support, and we need more paid sick days. We need to give workers time off to get their vaccines and to support them. Nasra, welcome. Heather, welcome. Faiza, welcome. Brian Walker, welcome. Brian says, all these schools are closed. Can any be used for vaccine sites? Many opportunities there. Exactly, Brian. Exactly. This is what we have been saying. It is unacceptable that community like ours have no permanent vaccine facility. This week, I stood up at the legislature and I asked directly the Minister of Health to provide us. Still, we're waiting a permanent vaccine facility. We can use the schools, we can use the community centers, we can use the old hospital, Church Street, we can use Jane Hub Center, we can use York Recreational Center, we can even use Western Lion Arena, even though it has been pointed out, it's not concrete, there is also sand there. But we can use the entire outside. There's big space there as well. And there are areas we can use. That is, we want to also pressure the public health and the chairman, Jay Crossy, to implement permanent locations in our community here. It's needed here, and we don't have it a permanent vaccine facility here. Write to your city councillor, Francis Nanziara, as well, to make sure she also advocates for our community, because she sits also a city hall, Brian. Thank you for joining me today, Brian. And Charity says that will be great for everyone. Indeed, Charity, we have to work together. Tammy said, welcome, Tammy, for joining us this afternoon. I agree, Brian Walker. Utilize the gyms for pop-ups. Exactly. Use all those facilities. These are community hubs. What is lacking here, Tammy and Brian, is leadership. My leader and I and the entire official opposition have been raising these issues. We have been propositioning. I have been speaking about this. I have written to the Minister of Health to ask her to provide options. I have asked Western Lions Arena. I just mentioned there's a concern because it has sand. It's not a concrete in there. But also we have York Recreational Center. We have the old hospital, 200 church. We have schools. We have many locations. We have faith centers. We have many places that can be implemented quickly. Every day, we need a permanent vaccine facility. Give us more vaccines. That's what's needed, not police state. Not police state. And Frank says, many opportunities indeed. However, Canada's and Ontario's acquisition of vaccines is pitiful at best. Well, I think we need to make sure that we need more vaccines, and we need it now. We needed this community, especially the hot spots and high risk area. Start here. Let's get our people getting their vaccines. And also in many parts of Scarborough also, my colleague Dolly Began has been also speaking about this. There has been appointments made in Scarborough. 10,000 of appointments have been cancelled because there is no vaccines. This is not right. They should know what's going on. And the solution is not a police state. It's to empower, to listen the public health or experts in medical health, to also listening the science table to make sure that we need a public health action now. Welcome. And Tammy says, I would volunteer. I know many of us would. Let us get this done. Exactly. My office have been also working very closely with Humber River Hospital. I would like to thank the CEO of the Humber River Hospital, Bob Collins, and also the head of the pop-up team, Ruben Rodriguez, who have been very helpful. They have actually worked with my office to help them organize, register, and take vaccines deliver to our seniors in our community. Many members of the community are ready. Tammy is ready. Tanya is ready. People are ready to volunteer and help. They've said so. Give us a permanent vaccine a facility or location, and the community will come and help. There are also retired health experts who will be able to help. We need more vaccines. We need to provide, designate more permanent vaccine locations in our community, and that's what's needed, not police state, folks. Thank you. Charlie says again, a lot of people are taking his information. He puts on Twitter. Oh, sorry, I missed something, I think probably. Let me go back here. Yes, Anthony says, thank you, sir. Roman is my, okay, you live, Michael lives at York Center. Okay, very good. And Jordi, okay. Christina, welcome. And Nasra, welcome. Zakaria, welcome. And Amanda, welcome. Well, thank you, folks. And also, our small businesses are also struggling, folks. And we are increasingly hearing from local businesses, owners, about issues with small business support grant application process. I know some of you have written to us. We have been sending those informations to the ministry liaison to find out why these folks have not been given or supported the small business support grant applications. Many are encouraging, many are encountering head scratching denials or getting no response from the government at all. If you are encountering similar issues with your application with regard to small business support grant, please write to me. Contact my office. You can reach at 416-243-7984, or you can write to me, fhassan-co@ndp.on.ca. And I will be happy to follow up with the ministry folks to explain to us why people who are qualified has not been provided the support they need. And if you have just joined, you're joining Faisal Hassan, NDP, through my Instagram, my Twitter, and my page, Faisal Hassan, NDP. and also my YouTube. If you haven't subscribed to my YouTube, please do so. Thank you. Thank you for joining Haji. Thank you for joining Zakaria as well. And we know also folks, vulnerable folks and people with Ontario disability support programs are also struggling. They're struggling. They continue to struggle in support. With many rely on a limited support. Of some of them are relying on food banks. The government must increase supports above the poverty level and allow people living with disabilities the opportunity to live with dignity and provide them support. Some of them don't even have affordable housing. Housing is very difficult, and they have other nutritious food as well, and they have limited income. And the last budget, they have cut, and they haven't even provided them any support in this budget as well. I'll continue to work on your behalf. I'll continue to work hard to address the inequities facing folks on Ontario Disability Support Program and recipients, and demand that the government provide additional resources during this pandemic and beyond. So thank you for those who have written to me and those who have wrote to me with regard to the issues and your also financial challenges. Victoria, welcome. And also welcome just those who just joined. You are joining Faisal Hassan, NDP. You're joining my Instagram, my Twitter, and also my page, Faisal Hassan, and my YouTube as well. And if you haven't subscribed to my YouTube, please do so. And with regard to vaccine, as I said, we don't have a permanent vaccine facility in our community. Recently, the West Park Healthcare Center has announced a booking system. Their booking system appears to be alive and working, including for individuals 18 and above in hotspots, postal codes. And I know many of you, I have engaged with you that quickly those appointments are not available. They're out, and they will be adding up. But we need more facilities, more vaccines to really come to our community, to hotspots. We need to give all workers paid sick days. We need to provide and give workers also a paid time off to get their vaccines. We need to take all the support we need to accept the federal government's offer for help. We need the Red Cross to come in, the military to come in, and also healthcare staff from other provinces as well to provide help for our community. We need, but the solution, folks, is not the police state. We don't want, again, cutting. Heather just talked about in her comments that she has been minding her own business in downtown and she has been carded. I've said that. I have also been carded, not one time, not second time, not third, not fourth, not fifth, but 6 times, 3 times the same police officer. So this is a public health issue, not a police issue, and we don't need a police state in Ontario. What we need is a public health action and plan to support our doctors, to support our science table, to make sure that they are provided the support they need and resources. We need to provide our workers paid sick days and also give workers time off to get their vaccines. And this is what's needed because paid sick days, it's been reported 60% of workers don't have it. And it doesn't make sense. If you are sick, you don't have to go to work, and we need also to shut down non-essential warehouse work so that, and also make sure that hotspots like our community gets their vaccines. And we need more. To this day, it doesn't make sense. It's unacceptable. To this day, we don't have a single permanent vaccine facility in our community. And that is not right. And I have this week had opportunity to question the Premier and the Minister of also Health to provide us a permanent vaccine location. And I think it's the right thing for you all to write also to the chair, Joe Cressy, the chair of the Public Health Toronto, and to make sure that they provide us more facility in our community. How come we don't have a single permanent vaccine facility in our community? You know, and also write to City Councillor Frances Naziara to pressure her colleagues to provide us those permanent vaccine facility in our community. Well, thank you for joining me this afternoon. If you just joined, you're joining Faisal Hassan, NDP, through my Instagram, my Twitter, and my Facebook, and also my YouTube. If you haven't subscribed to my YouTube, please subscribe it. Thank you. Charity here says, I know that where my husband works, he took the afternoon off to go get his first shot, and his boss said he will get paid for it, so not to worry. Well, that's a good news, Charity. We want every single worker, you know, to exactly experience that your husband has experienced. And we need folks to be not worried about paid. They should be paid to get that time off to get their vaccines. It's very important, Charity. Heather, Brian, welcome. Ali, welcome. Tammy says, Dan, very good. Appreciate it, Tammy. Please share those contacts to ride. And please share. Also, you can share the page. You can also, you know, subscribe my YouTube so you can get also instant updates as well. And Zakaria says, thanks, NDP. Well, thank you, folks. I appreciate them. And this week, folks, I asked Premier Ford to urgently bring a permanent vaccine center to our riding of York Southwestern, a vulnerable COVID-19 hotspot home to many essential workers and low-income residents. And this has been stated again and again. We are hotspots. We are a high-risk community. Despite being high risk, you know, our community has had to wait for pop-up vaccine efforts because there are no permanent vaccination sites in our community to this day. And this is unacceptable. And if we are being termed as hotspots, then we should have it. Why? Who is making those decisions? If they are concerned about dealing with these issues, then bring more resources to hotspots area, such as our community right here. Give us more permanent vaccine facility. Give us at least 2 locations so the community here could simply flock there to get their vaccines. Then the problem is solved. Focus more resources to areas like ours. The solution is not police state. That's unacceptable. We need those resources directed here in our community. I have stood in the legislature many times, folks, to ask why my community of York Southwestern has been neglected by this government's pandemic response. And you guys know also the neglect we had the last 15 years. And this last 3 years continues from bad to worse. And it is really getting really bad. How come if we are termed hotspots on high risk area, we don't have a permanent vaccine facility? It doesn't make sense at all. I took also remember on the early on the COVID testing, it took until September, late September 28 to be exact, for the government to provide us with a COVID-19 testing facility. And then later on, we had also a couple of pop-ups continuously. That was good. But it took until late September, from March 13 to late September 28. That's close to 7 months to have a permanent testing facility. And now, to this day, we don't have a permanent vaccination location in our community. It is unacceptable. This is not right. And if the Premier is concerned about the public health and the health of our community, give us more vaccines, give us a permanent vaccine facility right here in our community. And I have provided more options to the Minister of Health. I have written to a letter suggesting to have the old hospital, 200 Church Street. I've also provided the Jane Hub area. The hub there is a huge place. Also, some of you have suggested schools that can be used now. I've also suggested York Recreational Center. I've also suggested Western Lion Arena, even though some concerns have been raised there because it's a sand, it's not concrete. There's some areas that are concrete, but still there's huge space outside there. It can be set up a huge tent to really keep going and fascinating our community. Now the community is anxiously waiting a permanent vaccine facility, and that's unacceptable. It took us to this day. Today, we don't have a permanent vaccine facility, and that's unacceptable. And the premier is now calling a police state, and that's not what we needed. We have been saying this again and again and again. Give us more vaccines. Start vaccinating folks in hotspots. Listen to the experts, the public health experts, and let us focus public health plan and action to solve the problem. Many of you have frustrated the slow response from this government. I have been working also very successful with Humber River Hospital to bring pop-up vaccines clinics to our senior buildings and sites of worship in our community. And I want again to take this opportunity to thank my staff and also the folks from Humber River Hospital, Bob Collins, as well as also Robin Rodriguez, who have been very, who've shown their leadership and community action-oriented work to my office to facilitate, to organize, to register, and also to deliver those vaccines into the community. That was very successful, and we want to continue, the next coming weeks to make sure more members of our community can get their vaccines through their places of homes. Many seniors have benefited so far, but we want to give them more of them and work with them very closely. But also we want permanent vaccine facility as well, so that people who can register could go and get their vaccines there as well. I keep hearing from families, this government's rollout in our community is chaos, confusing, with people not knowing how, where to register. And this is also a problem. This week, we know that West Park Healthcare Center have announced, but we know that they are trying their best to book more appointments. Please keep trying, checking there to register them, so you get those appointments utilized. The government must get its act together and help some of our most vulnerable people get vaccinated. And it's very important. But the government now calls a police state. That is not the solution. That's not the solution. This is a public issue, and the experts should be listened to, not the police, and that's not a police job. Ontario is not doing great. Everything is not fine. People's lives are at risk, folks, and there is literally no time to waste. We need to get to get to work, but we need more vaccines, and we need a permanent vaccine facility in our community. Well, folks, those who are joining me, thank you for joining me and welcome. You're watching Faisal Hassan, NDP, through my Instagram, my Twitter, and my page, Faisal Hassan, NDP, and my YouTube. And if you haven't registered or subscribed to my YouTube, please do so. Thank you. Thank you to Tammy for doing so quickly. And also Heather says, wishing my building would agree to do the mobile vaccines. Why not, Heather? We could do that. We can suggest that. We could add to the list. We can share your building to Humber River Hospital, and let's see how we can work together. Why don't you just write me an email tomorrow, and we will make sure, if we can do that, well, let's do it and try to get to you as well. And they are horrible here, she says. Frank says, Faisal provides regular updates to the community as to what is happening. Register for updates. Yes, thank you, Frank, for reminding me this. Yes, if you want, I send twice a week a newsletter update, and those updates are very useful. It is up to to the minute. We sent out Mondays and Thursdays, so if you want to get them, please subscribe it, because you will contact us, and also we stay contacted. We'll be connected, and you will get also updates right away from us. Thank you. George says, I'll keep checking the hub as we live in the buildings. Very good. And George says, Frank, I get it. Very good. Heather says, we tried already and they said no to us. Well, why don't I advocate on your behalf, and we could propose to them again and see how what do they say. So if they're willing, if the building is willing, all we need to do is the building allows to be done, and then we can also talk to the Humber River Hospital and other groups to basically come there and visit every unit in your floor, and people could simply register early on and just get to it, So if the landlord is not willing to do it and is not allowing that I don't know what we can do, but I think it's the right thing to do. If many people want it to be visited, if not, then you can register through West Park Healthcare Center, and you have then two options: either community place hub, Western Community Place hub, or the Buttonwood address at the Jane and Western area. Okay, and okay, very good. And folks, well, thank you for joining me this afternoon. You are joining Faisal Hassan, NDP, through my Twitter, my Instagram, and also my page, and also my YouTube. And if you haven't subscribed to my YouTube, please do so. And we will continue to wait answers. We will continue to wait for answers from the government on its plan to expand vaccine access to individuals over the 18 years of age and workers in hotspot areas like ours. Although the Premier was eager to announce these new measures, no work was done in preparation for this important step forward. And they announced that everybody who lives in hotspots should be getting vaccines. But it appears that none is working at the moment. We now see the Westburg Healthcare Center has opened up for appointments, but quickly all those appointments are full. And I think keep registering folks. So perhaps that could be addressed quickly. Please do that. And we know now. Just quickly, let me take folks' comments. I'm trying to get in. Okay, the more people get there for vaccine, the better it will be for all of us. Exactly, and that's why we need more vaccines shipped, delivered to hotspots areas like our community. We need that, and also we need the hotspots communities to have a permanent vaccine facility. That's where you need to have locations to distribute vaccines. It doesn't make sense. The folks who are hotspots traveling far, bring them to vaccines to them. Have them a permanent vaccine facility. And that's what we need here in our community. And Tammy says, do you know how employers request for pop-ups to come to their location to get employees vaccinated? Yes, I think they could contact quickly the public health, or you can just send us an email, and then we could just connect you to them and to forward it to that as well. If they're located in our community, then we'll be able to connect them and identify that and say so and so is willing for you to come to do it there. But otherwise, I think you can contact the Toronto Public Health that way. That way, they'll be able to also provide direct information there. Welcome, Tammy. And says, Tammy says, I have had no luck finding this information. Excellent. Well, why don't you just drop me a note, or we can send you something on Monday, just if you contact to the public health office, Dr. Devella, and see what they say, and then get back to us. That way we will be able also to share information and to follow up with that as well with them. Thank you. If they are in our community, then we can advocate for them. Any employer wanting it to get their vaccines into their workplace. And if their workers are essential workers there, that's very important that we can do it quickly there. Well, the premier handling of this pandemic has been abject failure and absolute disaster. It is far past time for this government to introduce paid sick days. We need it. It's high time for this government to introduce paid sick days. Workers need it. And it's important if workers are sick, well, it's important that they stay home. And that's what we need this government to do immediately. And we need to guarantee a paid time off for vaccinations for workers. If they want to take time off to get their vaccines, they should not be worried about losing income. And that's very important. And we need to ensure that all frontline workers have priority access to vaccines. And it is important that we do that quickly and make sure that they have their vaccines right away. Well, welcome, Safia. Quickly, Ahmed Bawa says, can Ontario Human Rights Commission weigh in on some of these new measures? Definitely, it's very important. But for us, we don't think the official opposition do not support police state. It's not required. This is not an issue of the police. This is a matter of a public health. We are in a global pandemic, and people are doing their best to obey the rules. They're doing their best to stay home, but they are not being paid. They have been forced to go out and earn a living. But if they are paid to stay home, people will stay home. There's no question about that. But the solution is not a police state. Police going after people, minding their own business, having a fresh air. No, that's not what we will support. It's unacceptable, Ahmed. And Ahmed says, carding. It's like carding, exactly. I think I've talked about this earlier today, from 3 o'clock to 3:20, about why this is not right. And some of you also, like Heather, have talked about, she has been carded, and I've shared my experience with carding. I have been carded, not one time, not second time, not third, not fourth, not fifth, 6 times. And that 6 times, 3 times with the same officer carded me. And this is not what we want in this province of Ontario. We don't want police state. What we want is to support our public health, to listen to the public health, to listen to the experts, the medical experts, to listen to the science table. It's what we need. And we need public health action now, not police state. So our position is very clear on this, Ahmed. And thank you for joining me. Maria, welcome. Ahmed says, odd allocation of vaccine in low infected areas, neighborhoods versus high needs or ritualized neighborhoods. Exactly. That's why we're saying hotspots and high risk areas should be given their vaccines right away. The Premier, as you know, last week announced this, but he hasn't delivered. He doesn't have a plan. You don't just announce something. You have to have a plan. You have to have a clear, concrete plan to deliver them. To this day, our community do not have a permanent vaccine facility here in York Southwestern. And we are being termed as hotspots and high risk area. And that's not acceptable, you see? So that's why we are calling action now. And thank you. And Frank says, I think the police forces have stated that they will not be doing random COVID checks. However, the fact they have the permission to do so from the government is alarming enough. Well, that is not acceptable at all. Frank, we don't want police being instructed to simply, in the middle of a pandemic, to create more chaos, to create more harm to the people. We don't want police state, period. What we need is a public health. This is a public health issue. It's a pandemic. We need vaccines. We need it to get it to where it's needed. It's needed in hotspots. It's needed in high-risk communities. We don't need a police on this, because the police is not a public health experts. We don't want them being instructed to involve, and we don't want the premier calling for a police state here. We want a public solution, public health a solution, and the solution is to listen public health experts, to listen to science table, and to have a plan of public health action to implement it, not police state. And welcome, Jardy Darkford just reversed the ban on playgrounds. Well, he has been doing this for quite some time now. You know, that's not what's needed here. What's needed is a leadership. An NDP government will put you first and will have a clear solution to the public health and to this mess in order for us to get out of it quickly and get to the people's business right away. Ahmed says, yes, good point, but the potential is there. And how about Bill, Durham, and OHRC should have say in this area? Well, I do think that it is important that we send a strong message to this government that we don't want police state, period. We want a public health officials being provided the vaccines. We need to get the support that the federal government offered for the Red Cross to come in, to come the federal military to come in, We want also other jurisdictions, if they're sending us health staff, we want them, get in. A lot of folks of you, senior folks, retired folks, want to get involved and help. We will take that. Those are the right leadership is what's required here. And unfortunately, Darkford's conservatives' handling of this pandemic has been abject failure and absolute disaster. And welcome, Shin. Welcome, Terry. Terry Downey, how are you doing? I hope you're doing well. Welcome. And Ahmed says, police have enough to do. Well, I agree with you. We don't want the police state. This is a public health issue, okay? And this is a public health issue. It's not an issue of a police issue, period. And it is not a police issue, period. So this is a public health. We need a public health experts being listened. We need to hear their professional experts. We need to listen the science table, and we need to provide vaccines to communities like ours that has been termed as hotspots and high-risk community. We need it here in our community. And that's why I've been advocating on your behalf to have permanent vaccine facility. To this day, we have none, and that's unacceptable. And this is not a leadership. This is not a leadership. And we need workers to have paid sick days. We want workers to get off, to get their vaccines as well. And this is what's needed. We need to have a guarantee paid time off for vaccinations for workers. We need to pay paid sick days for workers as well. And we need to make sure, to ensure that all frontline workers have priority access to vaccines. Folks, thank you for joining me this afternoon. I know you have a lot of issues. You have a lot of issues to talk to me about, but we will join again next Saturday to hear your concerns and to also answer some of your questions. You can join me here every Saturday from 3 to 4. You can join through my Twitter. You can join me through my Instagram. You can join me my page, Faisal Hassan, NDP, and also my YouTube as well. And if you haven't subscribed my YouTube, please do so that we can get to you right away. You can get instant videos and also any issues that we put there as well. So my time is up, folks. And thank you for joining me. And thank you. This is Faisal Hassan, your member provincial parliament for York Southwestern. Until then, until next Saturday from 3 to 4, thank you. Stay well, stay safe, and make sure you wash your hands, you practice social distancing, you wear your mask, and you respect your neighbors. And make sure if you have any concerns, any issues you want to share with me, you can reach me through my email, fhassan-co@ndp.on.ca, or you can phone 416-243-7984. Thank you. Until then, have a wonderful afternoon and enjoy the rest of your weekend. Ciao.